The following portion of Studio 512 is sponsored by Advanced Pain Care. A letter of protection, or LOP, is a legally binding agreement that allows an injured person to receive medical care without having to pay for it immediately. Here to talk to us about how letters of protection work at Advanced Pain Care are Dr. Matthew Hellman and Personal Injury Director Yuvia Pangilinan. We're happy to have you both here. Yuvia, my first question is for you. Talk to me about how the process works when someone gets referred to APC with an LOP.
So normally it starts with a letter of protection being sent by an attorney or another provider. Once we get that letter of protection, then we are able to move forward with scheduling the patient with one of our board certified physicians.
Wonderful. And what kinds of letters of protection do you see?
Generally, we see patients that have injuries that have resulted from a motor vehicle accident, a slip and fall, or other incidents that resulted in personal injury.
Gotcha. Okay, Dr. Hellman, what happens when those patients that come through the door with a letter of protection see the doctor?
So when a patient is seen at Advanced Pain Care, we recognize that every person is different. We'll start with a full discussion of what occurred and how the injury or trauma was sustained, because certainly the mechanism of injury can change what occurred to you and what is actually causing your pain. We work with conservative care, maybe a referral to physical therapy or a chiropractor. We'll also order appropriate imaging if we think that somebody needs it to really figure out what's going on. And then finally, we'll start with some medications to help, maybe some anti-inflammatories or muscle relaxants while we're going through the whole workup in the conservative care.
When people come to see you with letters of protection, usually how recent has the incident been?
It's a great question. I've seen some that are as recent as 1 or 2 weeks beforehand, especially if they're in pretty bad, severe acute pain. They need to see a specialist almost immediately to get out of this pain, even just to be able to sleep at nighttime. Others have been maybe a couple months in the past, and there's just some lingering injuries that just won't recover. And so that's when it would be time to come see us at that point.
Why should people come to Advanced Pain Care?
So people should come to Advanced Pain Care, one, because we're experts in medicine and what we do in interventional pain medicine, but more importantly, we have the best support staff that helps ensure that everything is done in an efficient manner. When you see us, there's no waiting around, nothing gets lost in translation, so to speak. We work with other specialists, orthopedics, neurosurgeons if it's needed in your case. And our staff is great at communicating with them. We communicate with them ourselves, doctor to doctor, if needed. And you're never really waiting. We want to make you feel better as soon as possible, as efficiently as possible. And I can't thank our support staff enough for making that happen for you.
Sounds good to me. Y'all, thank you so much for your time.
Thank you.
Thanks.
To learn more about what you could do if pain wasn't holding you back, talk to the doctors at Advanced Pain Care. Go to austinpaindoctor.com to get help managing your pain today. The preceding portion of Studio 512 was sponsored by Advanced Pain Care.